Good morning to you all. I'm Renee Francard with Cabinet Communications and the moderator for today's COVID-19 update. We are joined today by Premier Sandy Silver and Minister of Community Services, Richard Mostyn. Closed captioning is provided by National Closed Captioning. Thank you to Mary Teason for providing our ASL interpretation today. Following the remarks from our speakers, we will go to the media present in the room and on the phone lines for a round of questions. We will call you by name, and you will each have 2 questions. Before we begin, I would like to verify that everyone can hear us. If any of the reporters are having problems, please email ecoinfo@yukon.ca. I will now hand it over to Premier Sandy Silver.
Thanks, Renee. And thank you, everybody, for joining us today on the traditional territory of the Kwanlin Dun First Nation and the T'Ongkwatchin Council. It's great to be here today with Community Services Minister Richard Mostyn for another COVID-19 update, and of course, Andre and Mary as well. We have a continuing improvement situation in Yukon. Today we have 2 new cases to report. The current number of active cases in Yukon is 45. Though that number may change as today we'll be seeing some recoveries hopefully confirmed. We will continue to report these daily numbers online at yukon.ca, so you can check there for the most up-to-date information. Our total number of active cases continues to decrease, and this is absolute welcome news. We are happy the overall situation is stabilizing, and we have seen no new outbreaks. Thank you, everyone, for all that you do in your part in stopping the spread. I know that it's not easy, but I also know that things are getting better. There have been public notifications issued this week as well. You can find details about these online as well at yukon.ca. Anyone experiencing symptoms in Whitehorse should call COVID-19 Testing and Assessment Center, and that phone number is 867-393-3083. You can also book online at yukon.ca to arrange for testing. People in the communities should contact their rural community centers, their rural community health centers. Testing turnaround times remains very quick, and you can access negative results online. Getting tested if you have symptoms absolutely remains an important part of lifting the spread of COVID-19. Another pillar of our ongoing response to COVID-19 is immunization. We now know that vaccination is a powerful tool that allows us to treat COVID-19 as a preventable disease. The vaccine is the best protection that we have now and into the future. As of Monday, more than 80% of eligible Yukoners over the age of 12 are now fully vaccinated. A big thank you to all of our community partners, Team Balto, Team Togo, Team Fox, and especially all you Yukoners for getting us to that remarkable percentage. We need to keep these numbers going up. The more people getting vaccinated, the safer our territory will be. We have seen throughout the past 2 months that this virus is extremely troublesome, but vaccination has played a key role in preventing disastrous outcomes. So please, if you have not received your shots yet, please book an appointment online at yukon.ca/thisisOurShot. You can also drop in at the clinic here in Whitehorse or at the clinics that are popping up again in the communities. The teams will be in Old Crow, Watson Lake, and Ross River this week, Dawson and Watson Lake next week. I want to thank again all the Yukoners that have spoken out about how catching COVID helped them overcome their vaccine hesitancy and who have urged others to take their shot. This is powerful testimony. I know that it's not an easy conversation to have, but it is so extremely important. The vaccines save life, there's no doubt about it, and the more people that get vaccinated, the safer that our territory will be. We are currently leading the country when it comes to vaccinations, and that's really exciting. Last week, we lifted some restrictions that we had in place, We recognize that this is still a tense time for folks. Transition usually is, and transitioning away from border controls and mask mandates towards living with ongoing risks of COVID-19. It's a daunting task for us, and it's a lived experience for Yukoners. Again, we are ahead of the curve with vaccination rates, and we're kind of a test case for a lot of the rest of Canada. I would remind you that while you are no longer have to wear a mask indoors, it is still strongly recommended. I'm still wearing mine when I'm grabbing groceries, still wearing mine when heading to restaurant washrooms, different public places where, you might feel that you might be too close contact. I want people to feel comfortable, and I know that we're all moving at different paces through the nation and the world, but we need to adjust to things. It's really important to continue to be respectful of businesses and organizations that continue to require masks as well. We all need to keep in mind that our individual actions, they have an absolute impact on the entire territory. So we all have a role to play, and we need to be kind and helpful to each other because that's how we're going to get through this, and we are all in this together. Our government will continue to work with our partners throughout the territory to adapt to the current risk and to ensure the appropriate tools are in place for all Yukoners. As we have been saying for weeks, the risks are decreasing as vaccination rates continue here in the territory and across Canada. That means that we can shift our focus to a more targeted response to the threat of COVID-19. The broad public health measures we have relied on to date are no longer necessary. Minister Mostyn is here today, and he's responsible for the Civil Emergency Measures Act, and he will be discussing the current state of emergency in a moment. Even as we transition back to normal, we remain focused in protecting the health and safety of all Yukoners. We have a number of tools that we continue to use to manage the pandemic, and we will continue to actively respond to the risks and to adapt as necessary. Thank you, everybody, for listening today, and I'll pass it off to Richard.
Thank you very much, Premier. Thank you all for joining us here this morning on the traditional territories of the Kwantlen Dun and the Tonquachin Council. It's really great to be here today with you. As the Premier just said, we recently lifted some of the restrictions in place based on the recommendations of the Chief Medical Officer of Health's office. Mask use in indoor spaces is no longer mandatory, but it remains strongly encouraged. As the Premier mentioned, we want people to respect stores and restaurants' requests that patrons continue to require mask use. Yesterday afternoon, I was in Whitehorse International Airport picking up family. It was a very busy flight. It was nice to see, actually, the airport hustling and bustling again. But I don't think I saw a single person not wearing a mask in the airport. So in the Yukon, we are emerging carefully and methodically from an unprecedented public health emergency, and it's important people feel safe as we do that. Self-isolation is no longer required for those entering the territory. The federal government has also changed the rules at our international border to allow fully vaccinated Americans to come into Canada again. Now, this is welcome news for many of us who have close connections with Alaska and the lower 48. It's also good for tourism operations and businesses that rely on travelers. Yukoners may see more American plates in the territory over the coming weeks and months and years, and we encourage them to respect the hospitality that Yukon has become renowned for around the world. Bars and restaurants are also at full capacity, though they must still use contact tracing sheets. This measure is designed to protect the health and safety of you and your fellow Yukoners. There are still limits on size of social gatherings. Social gatherings are limited to 20 indoors with physical distancing and limited to 100 outdoors with physical distancing. Organized gatherings, well, both indoor and out, are limited to 200 people with physical distancing. Large gatherings is where we saw our spread occur during our June outbreak, and size limits have been very effective in helping reduce our case count, as the Premier has mentioned. Today, our vaccination rates continue to rise, and our case numbers are decreasing. The state of emergency is set to expire on August 25th, and if these trends continue, the Yukon will not need to extend it further. The most significant change once it is over will be the end of enforcement measures under the Civil Emergency Measures Act. But the emergency also allowed administrative measures to support Yukoners impacted by the pandemic. We allowed the Yukon Medical Council to issue provisional licenses to new graduates whose qualifying exams were delayed due to COVID-19. This helped cover absences within our medical community. We enabled pharmacists to prescribe and extend prescriptions. This helped ensure patients receive uninterrupted access to vital medications throughout the pandemic. We also saw flexibility around legal obligations, and that helped support individuals who couldn't travel or needed to self-isolate. These are some of the 14 orders we used to support Yukoners over the past 17 months or so, and as our world got turned upside down. And many of these orders end with the state of emergency or after a prescribed transition period after the fact. The Department of Community Services is working on how we transition from the emergency in a planned manner that continues to support and inform Yukoners. I want to thank all the public servants who have helped us manage the pandemic over the past year and a half. I also want to thank Yukoners for all the sacrifices that they have made, for the genuine thoughtfulness and consideration they have demonstrated for their family, for friends, for neighbors, and strangers. That took discipline, and it has saved lives. There are people walking the streets in town today that wouldn't be here if it weren't for that dedication and that thoughtfulness that Yukoners have shown. I said it a couple of weeks ago. Civil servants, nurses, doctors, and Yukoners stepped up and became part of the best vaccination program in the nation and arguably one of the best in the world. It wasn't easy. Delivering this wondrous medicine took skill, and few people like getting jabbed in the arm. So it's been an immense effort on the part of Team Yukon. That's all of us. And we are just now starting to see some of the benefits of that hard work over the last 18 months. But the necessity for thoughtfulness and consideration that we've demonstrated in the Yukon doesn't end with the state of emergency. It must continue in the face of this now endemic illness. The only thing ending, really, is the enforcement. But society still has a responsibility to do what they have demonstrated they know is right. We will continue to monitor the situation in the coming weeks and continue to engage with our partners throughout the territory. We remain focused on protecting the health and safety of Yukoners. As the Premier touched on, we have a number of tools we continue to use in response to the pandemic, and we will continue to actively manage the situation. We are simply adjusting our approach. Testing, rapid response teams, critical support, social support workers, and expanded vaccine access are just some of the tools we're using in this transition. We continue to follow the recommendations of the Office of the Chief Medical Officer of Health, as we have throughout the pandemic. Nothing has changed. Nothing will change. If the risk changes, we will adapt as necessary. The availability of vaccines, these safe, marvelous wonders of science, have completely changed the landscape when it comes to COVID-19 and significantly changed the risks we are facing as a society. It is imperative that everybody who can get vaccinated, as the Premier said a few minutes ago. We have one of the highest vaccination rates in the world, and we can take comfort in the strong level of protection that provides our entire community. And we will keep working with our partners to push that number higher and increase that level of protection. We are all in this together, and we will get through this together, as we've demonstrated over the last 17 months or so. So thank you.
Thank you, Premier. Thank you, Minister. We will now move on to the question and answer session with media. A reminder to reporters, please identify which speaker you would like to answer your question before you start, and please also remember to mute and unmute yourselves. We will first go to the reporter in the room and start with Luke at CKRW.
Hi, a question for Minister Mostyn. You mentioned a possible transition period out of the state of emergency if it does happen to expire. You don't extend it after August 25th. Could you give some examples as to what that would look like? Is there mandated enforcement from the government still in some way?
It's things like driver's licenses. Like seniors have had a period of time where they haven't had to have their driver's license exams when you're an older person. When the state of emergency ends, I think we've got like a 90-day period where people can come and get those affairs straightened out. So there's pieces like that are really administrative procedure orders we put in place. And when we drop the state of emergency, we know there will be a backlog to deal with some of the cases, doctors, that type of thing. So we're just feathering that, and that was built into the orders when they came into being. But for the most part, life will resume to where it was prior to the pandemic, with people taking personal responsibility for their health. But really, we've demonstrated the ability. We have the tools now to do that, and I have every confidence that Yukoners who have demonstrated such an overwhelming concern and care for their fellow citizens in this territory will continue to do the right thing after the state of emergency ends.
Thank you. Another question, Luke?
I do, and this one is for the Premier. With the potential of the Moderna vaccine being approved for 12 to 17-year-olds at some point soon, they're going through trials still, is there a possibility that the government might acquire more vaccine of either Pfizer or Moderna just to keep up with youth vaccinations, or are we at a point where we have enough supply right now?
We're always engaged with the federal government as far as distribution, and as you know as well, Luke, we were recognized as northern rural and Indigenous communities being prioritized for health reasons right across Canada. The Chief Medical Officer of Health has said in the past, we're not necessarily picky. Whatever we get, but at the same time, we've proven to be very successful with Moderna and the storing and the distribution therein, and also now with Pfizer with the 12-year-olds and up. So we do have enough supply currently, but again, as new trials begin and those age limits reduce, we'll send the message again to Ottawa that we're ready, willing, and able to distribute the vaccines that we get delivered.
Thank you.
Yep.
Thank you. We'll now go to Haley on the phone lines from Yukon News.
Thank you. I'm not sure who this question is best directed at, but either feel free to answer. Now that we're moving to a more personal responsibility model of managing COVID-19 risk, I'm wondering if there'll be more detailed information released, like the vaccination data for individual communities to help people make those choices about their risk?
Yeah, it's a good question, and a lot of folks' questions will be answered when we, release some more information about how we replace a path forward. As we go from a pandemic to an endemic, we'll continue to work with recommendations from the Chief Medical Officer of Health. I guess the biggest change is obviously the restrictions won't have that enforcement piece to it. Minister Mostyn spoke about some of the backlogs that we will endure as we get back to normal. But what we will continue to do is make sure that the advice that we're getting from the communities is, extremely important, and we need to be able to look at things at a more case-by-case basis. As as you've been reporting on this over the last year, numbers in communities, and policy therein have changed at different times based upon, giving people the information they need, but also protecting the information privacy of individuals. That model won't end. We'll continue to adhere to that, but at the same time, we do have to now change and work with the leadership in each community to decide what's the most important piece for each community. The doctor has said before, 80%, that's great. Now it's more of a microcosm of that. We need to look at the communities that are under-vaccinated compared to over-vaccinated and really focus in efforts therein. And as far as the reporting of numbers, that is based upon consultation in each community, really.
Thank you. Do you have another question, Haley?
I do, yeah, thank you. I was wondering if you have some advice or criteria for assessing risk when it comes to mask usage. I mean, is it more important for people who tend to be spending time with unvaccinated people, whether it's for work or social? Is it more important, for example, that they be wearing masks? Do you have advice for assessing risk like that?
It's a really good question. And, you know, there's a question about inside that about personal responsibility. There's a question inside of there about, you know, the CDC's reports on the efficacy of masks for vaccinated versus unvaccinated. You know, and really we don't have the ability as individuals in our society to know who's in the room. So I think, you know, we've always said all the way along this pandemic, you have to act as if COVID is right beside you. And, you know, as restaurants had their guidelines, it was based upon that fact. We in Yukon, we went through a long period where we didn't have any cases, and yet still Yukoners understood that mentality for the most part, which is great to see. When outbreaks came, we knew that the guidelines we had in place were effective to reduce the spread, and our traceability was impeccable. When it comes to masks moving forward, now that we have a population that's very well vaccinated, and we don't have the justification for the fines and that type of thing, I think it is again important for Yukoners to remember where they are. You know, if you're in an airport, like personally, I'm wearing a mask. You know, sitting beside people, I can't be at one caribou away from somebody. I'm still going to wear that mask. The other day I was in the grocery store, and it's great to be able to see people, you know, walking around a little more normal these days. But again, personally, I still think that I will be continuing to wear that if I find myself in situations where I can't be safely distanced from others. As a fully vaccinated Canadian, it's my way of showing the community that this is still real and still important to me.
Thank you. We'll now move to Tim with the Whitehorse Star.
Yes, good morning. Can you hear me?
We can, Tim. Thank you.
All right. I guess my question is either for the Premier or the Minister. I'm kind of wondering, with the daily case counts limping along, it's say about an average of 7 cases a day is what it's been for a couple of weeks now, whether maybe the public is looking at this the wrong way and expecting to see that number go to 0. Are we going to continue to sort of grumble along with a few active cases every day for the foreseeable future, or maybe kind of permanently?
Yeah, very hard to predict. You know, as Delta replaced other strains, as I had heard a stat the other day of 80% of the cases in Canada, you know, we have to adjust accordingly. And, you know, as new strains come down the pipe, you will have to act accordingly as well. It's so hard to predict. We're so you know, we're in a good position now. You know, the cases haven't been over double digits in a while. We announced today's cases today, and of course all that information is on Yukon.ca. We just need to be prepared for whatever comes with this virus. And so far, the success of Moderna and Pfizer and the boosters to be able to keep vaccinated people at a very high percentage of safety is encouraging news. The nature of these mRNA vaccines is also good news, because they're plug and play as far as variants go. Those trials should be very quick as the variants continue. I'm not a doctor, so I'll stop there. But we will definitely rely on the Chief Medical Officer of Health and that office to make sure that whatever comes down the pike, that our systems will, our healthcare systems will be ready for the next chapter. I don't know if you have anything to add to that, Richard, from your perspective.
Yeah, I can certainly, I'll weigh in a little bit. The goal, you know, I come from a public safety, a workplace safety background. The goal is always 0. We want to look around and see, nobody wants to see somebody get hurt or get ill. So the goal as a society should always be to get to 0. But that's, right now, in the face of this virus and all the variants we're seeing, is going to be very, very difficult. So that's why I have every confidence in Yukoners to do the right thing. They know. And when this thing hit in March, when we put the state of emergency in, we were dealing with an unknown illness, one that had only been on in the world for a few months, really. And in the course of 18 months, we have developed vaccines, a speed with which just boggles the mind. It really, really does. We have safe medicine that didn't exist 18 months ago is now saving billions of people around the world. It's absolutely incredible. And that is the key to our success as a society going forward, is getting those vaccines in our arms. Some people can't have them. Some people won't get them. So we have to do the right thing and protect our fellow Yukoners. And over the last, 18 months, we've developed the PPE. We've trained ourselves. Dr. Hanley told us that the training would be difficult. It has been difficult, but we now know how to distance ourselves, how to wear masks, to wash our hands, to just, if you're in a busy store, to don a mask, because you just don't know who you're with. If the store isn't busy, then you probably got a little bit more latitude. If there's conditions, people are going to have to look around and just assess the situation, take a personal interest in what's happening around you and adapt to where it is. I carry a mask in my pocket now all the time, and I don it when I deem it necessary. And if I feel safe, if there's nobody around me, I may take it off. So it's all going to be on us to do this, to continue to care for our fellow Yukoners, our friends, our family, our neighbors, and strangers as we navigate these waters going forward.
Thank you. Tim, do you have another question?
Yes, just one more. I'm not sure either the Premier or the Minister can answer it because it's probably more of a medical thing. Are we inching closer to having a formal recommendation on whether booster shots are going to be needed for people?
Yeah, I wouldn't weigh into that as ministers or premier. That is, we'll continue to be updated by the public health officials that, in my opinion, right across Canada have done an impeccable job of keeping us safe. No sense in speculating moving forward, but we will definitely be taking the recommendations from those public health officials.
Yeah. Tim, I'm not a doctor, and I don't play one on TV. So I'm going to just defer. We've taken the recommendations of the Chief Medical Officer of Health throughout this pandemic. That office has guided us really, really, really well. And nothing has changed on that front. We are still taking the recommendations of the Chief Medical Officer of Health and implementing them, and that's the path forward.
Thank you. We'll now move to Nick with the Canadian Press.
Hi, I was just wondering if the Premier would be able to kind of comment on, I guess, if there's any concerns about the kind of management of the pandemic response with Dr. Hanley taking a leave of absence to run in the potential upcoming federal election.
The Chief Medical Office of Health is exactly that. It's an office of health professionals, of public health professionals. We have an amazing alternative in Dr. Elliott, who, from the very early onset of this pandemic, has been providing our offices with extremely difficult but bang-on advice and recommendations. Early on, Nick, we had to cancel the Arctic Winter Games, and at that time, it was Dr. Elliott who was in charge at that time, and it's, again, that would be the forward-facing public official, but behind the doctor, well, it is whether it's Dr. Elliott or now as well Dr. Cancer, who was from Dr. Henry's office in BC, that is stepping in as well. There is a team of professionals in that office, not just only in Yukon, but right across Canada, that have, again, I've used the word a few times today, have provided impeccable advice. So the forward-facing head of that office is no longer there as of the Monday announcement. But at the same time, the office is still integral in our approach, and the officials in that office will continue to do what they've done all the way along, keep Yukoners safe with the most up-to-date recommendations.
Thank you. Nick, do you have another question?
No, that's it from me. Thank you.
Thank you. We'll now move to Marianne Laura Boreal.
Je n'ai pas de questions, merci beaucoup.
Thank you. That concludes our COVID-19 update for today. Stay tuned for more information on the next COVID-19 update. Thank you again to Premier Silver and Minister Mostyn. Thank you also to all the media on the line and in the room, and everyone who tuned in to watch over Facebook. Have a wonderful Wednesday.